And we're back. Did we go somewhere? You know, topic on Facebook right now down in West Plains is pretty hot and heavy about screw the OZH bullshit, Ozarks Healthcare. It's OMC, Order My Casket. A lot of bullshit, a lot of discussion going on right now about some recent layoffs or terminations. I think it was terminations. I'm not really sure. Story I read said something like 120 or 130 employees or positions had been eliminated. Now, some of those positions were vacant anyhow, and my previous nurse practitioner, probably one of those positions that they were talking about. When COVID happened, it seems like they laid off about 100 and something employees, and my nurse practitioner was one of those. And you know, this is one of the things that never did ever make any sense to me, was we were in the middle of a medical pandemic, and hospitals around the country were furloughing employees. And the strange irony of that was a CNA from Buffalo, New York could become a traveling CNA and move to Des Moines, Iowa, and make 3 to 6 times the amount of money that this CNA was making up in New York. Same goes for doctors and nurses and other medical staff. There's nothing that anybody can do that is going to help me to understand that. Medical pandemic, hospitals losing revenue, lay off 1/3 of their workforce, and then bring in people from a different part of the country and not only pay them 3 to 6, sometimes more than what they normally would make, but they also house them, renting a house or an apartment or, you know, whatever the case may be, pay their utilities, give them per diem for living expenses. It's ridiculous. Absolutely. You know, at one point in time, I worked at Ozarks Medical Center. I was hired in the lab, and you know me, I'm a driver. Okay, I like driving. It's peaceful out there, except for when you're in traffic. But I was hired in the lab as a courier, and then my position got moved into materials management, which made sense because I was delivering supplies and whatnot as well, you know, as well as picking up lab work and delivering results and blah, blah, blah. When I was in materials management, I found out that a bag of saline, I wished I had a prop, but everybody knows what a bag of saline is. It goes up on that pole, they stick an IV in your arm, and it's got basically salt water. $1 is what those cost. It cost $100 for them to put that bag in your arm. Another $100 to put the needle in your arm so it could go down through that 12-cent rubber tube that delivered it. The markup in healthcare is astronomical. It's unreal how much they mark things up. And the old saying was the 80-20 theory or whatever. 20% of the people pay for 80% of the medical care because 80% of the people don't have insurance. They can't afford their co-pays, blah, 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 blah. Well, that may be partially true, but it's recently been revealed that the CEO at this particular hospital, Ozarks Healthcare, it doesn't even sound right. OMC, Ozarks Medical Center, down in West Plains, Missouri. The CEO, 2 or 3 years ago, in the heart of this medical pandemic, was drawing a salary of $600,000 a year. $600,000 a year. And the bastard couldn't even pay me for a burled piece of wood that I cut down out of a tree for him. It's sad. It's pathetic. It really is. So anyhow, they've eliminated 130 positions or something like that. There's, I think they said 30 of those positions were already vacated. Again, that probably goes back to the furloughing 2 or 3 years ago. But that's 100 people that can't pay their rent this month. 100 people that can't buy groceries this month. 100 people that won't be able to pay their electrical bill this month. When the CEO is making more than $500,000 a year. And like I said, that was 2 or 3 years ago. I recall one of those "you can't tell this to anybody" conversations that I had with my now ex-wife, who happens to be an admin at that hospital, telling me about them voting to increase his pay to $750,000 a year. Now, if you're making $750,000 a year to sit in a chair and send and read emails, should you get paid PTO, paid time off, vacation time? I mean, you can take it, but should they pay you for it? And this is the caliber of that sorry son of a bitch. He's got a son that's got autism or something like that, and my heart goes out to this young man. I've met him. He's a really neat guy. But they registered him for the Make-A-Wish Foundation several years ago. I don't remember when it was, but it was after he was already the CEO of OMC. And I don't know, do they select somebody that they're going to do their thing for? And his Make-A-Wish was to go to Hawaii, which is awesome. Hawaii is a wonderful place. Absolutely wonderful. But Tom Keller and family took advantage of the Make-A-Wish donation, and then while they were in Hawaii, decided to stay an additional week that they paid for. Isn't Make-A-Wish for the kids that can't afford those cool things? I mean, I remember one time when I lived in the Florida Keys, there was a kid down there that was selected for it, and he wanted a white Christmas. And so they trucked in snow from someplace up north, and they covered this park, and it was a beautiful, beautiful winter wonderland. This kid was dying from cancer. His parents couldn't afford to pay for a 2-week vacation in Alaska to where he could see a white Christmas. People, I don't say it is what it is, because it ain't. Okay? Ain't nobody gonna change nothing until you stand up and shake your fist.